Welcome to Gen X Medic. We're here to talk about cardiac arrest, one of the most dangerous things that happen to people. The information is going to be for both lay people and for EMS professionals. I'm going to try to both give you guys some basic understanding of why we do the things we do, and we're going to discuss why it matters and to see things from each other's points of view. Because both sides have a tendency to not see things from the other person's point of view because it's a high-stress situation and there's a lack of knowledge on one side and I've got to get things done mentality on the other side. So, first, as a provider, when I started, we still picked people up, scooped, and ran to the hospital as soon as we got an airway and an IV and pushed a round of drugs. That's just how we did things. Hurry up and get to the hospital. Didn't matter that we were doing poor CPR. Didn't matter that we had to stop CPR to push medications, what have you. Those things were not taken into account. The mentality was we needed to be with a doctor. The public still has that mentality. That's what they know. That's what they were taught. That's what they were shown in movies. That's what they were shown on television. That is a horrible, horrible mentality to have. And you're the only ones that can intervene and help the families of the people that are in the cardiac arrest understand this. Now, the reason we quit doing this is because we actually follow the exact same rules and procedures in the field that they do in the hospital. Hopefully, your community has good involvement with both fire and your EMS to work together to have the proper outcomes. I'm fortunate where I work, we do. You will never hear me. I can't say enough about the support we get from our fire department on cardiac arrests and in many other types of calls, but the cardiac arrests are really something that's important. When we come in, we've got to quickly assess the situation, find out what needs to be done. Now, as a layperson, understand, during those first 3 or 4 minutes, a lot of things are going to be done, and they may not be able to get to you to ask the questions that they want to ask. The chances are they're going to. They're going to ask questions. They're going to want to know what's going on because these things provide insight into what we're doing and how we need to go about things. The treatments we're going to provide. Even once we start relaying that to the hospital, I'm going to use a term called ROSC. It's return of spontaneous circulation. It means that someone's heart's beating again. During initial resuscitation, that's your primary goal, is to get the heart beating again, because without that, nothing else can happen. So, providers, I understand that it's a high-stress situation. I've been there 24 years. But understand that, try to keep it in your mind that this person that you need information from, this is one of the worst days of their life. I know you know that, but you need to feel it too, because that'll help you communicate with them. Try to explain what you're doing, why you're doing it. Most places that I know of at this point are not moving people in cardiac arrest unless they obtain ROSC or there's other certain specific criteria. No need to go into that. The people who need to know that are the people that are responding to your area, because it will be locality dependent. If you're a family member, as long as you can step back a little bit and allow the individuals taking care of your family, I encourage you to look, understand what's going on. If nothing else, it'll allow you to know they are working very hard, very diligently for your family member. And providers, I promise you that the family members will remember that. That is probably one of the most important things that we can do that it's hard for us to do. It feels like we're putting on a show. I mean, we're not actors. I mean, we're people who make decisions. We're not there to make things look pretty for the camera, because working a code's not pretty. Working a cardiac arrest is a very messy situation. Just based off where you're at, you don't have everything there to make it nice and pretty. So, if your family, one of the things that I'm trying to encourage more and more is for you to learn CPR. Lay people, please learn CPR. There needs to be a more community outreach and basic hands-on CPR classes everywhere. This will save more lives than you know. Hands-on CPR is the first key to people living. If you see your family member go down, get on the phone with 911. Most 911 will walk you through the process of doing compressions and help you. But I wanted to get to the point that we're not waiting on that. I wanted so way family members know that they know how to do CPR. Hopefully you will have another first responder. In different communities, you've got AEDs put on police cars, fire engines, and to my knowledge, almost every ambulance in the country has a defibrillator on it. These things are the most important aspects to cardiac arrest survival rate. Early CPR and getting a defibrillator to that patient. Providers, when you're communicating to the family, keep communicating with them. Let them know what's going on. If things aren't looking good, it's okay to let them know. Just explain you're doing everything you can. Keep them involved in the final decision making, because it is their family. Because the people that witness this cardiac arrest are patients. They are someone who is being massively impacted by this event. And sometimes we don't remember that because we're so busy. We've got to get this done. We've got to get that done. It's all got to be done. And it does. It really does. But you've got time as you're doing things. Make a point to communicate what's going on. Hey, we've got an airway secured. We've been doing CPR. We've gave some medications to try to correct the problem with their heart. We've defibrillated them, X amount of times. If things aren't looking like they're going to have a positive outcome, and it's time to cease resuscitation efforts, talk with them. Explain to them why. And lay people understand it's not a lack of compassion when the responders are doing that. It's just things aren't working. Because once someone's heartbeat stops, it is a difficult thing to get it restarted. I can tell you my family's been impacted by this and by some amazing responders in the past. And that's very important for you to know that my family has been on the other end of this. Obviously, I've been on the responder end as well. This is Gen X Medic. Hopefully you found this educational content helpful. My views don't necessarily represent my employer or any other groups I am associated with. Thank you. Have a good day.